Hello, welcome to the channel and welcome back for all our regular viewers to another COVID-19 update. Today the weather is 24 degrees Celsius and cloudy. It is quite warm, but it's a little bit sort of overcast and not much sunshine coming through today. So as usual, first we will go to the numbers. So the numbers for China: in total there are 78,630 confirmed cases, 2,747 deaths and 32,531 people who have recovered. The active cases, that's the total cases less deaths and people who've recovered, are 39,755. Still, a majority of the cases are in Hubei province, and Hubei today recorded 409 new cases. However, they've also recorded 2,286 recovered cases and 26 deaths. Still continues to be 4 provinces that have a total of more than 1,000 confirmed cases: Guangdong with 1,347, Henan with 1,272, Zhejiang with 1,205 and Hunan with 1,017. As cases are decreasing here in China, cases are however picking up in the rest of the world. In Asia, South Korea, Japan, now Europe and also the Middle East. So on to global figures. Currently confirmed total global figures are 3,554 confirmed, 54 deaths and 292 recovered. There are 449 new cases in South Korea, bringing their total to 1,558. Other notable increases are Japan with 32, Italy with 147, Iran with 44, Bahrain another 10, taking their total to 33, and some European countries which we are now seeing cases in. In Europe, Italy saw 149 new cases, taking their total to 455. We also see 9 new cases in Germany, taking their total to 27. France has 4 new cases, Spain has 6 new cases, and Greece also now has their first case. So it appears now it is starting to spread more widely throughout Europe. Okay, now for the death rates. As usual, I have 2 figures for each set. The first figure is based on those who have either recovered or died and doesn't include the current people with the virus. And the second number includes the dead, the recovered and those people currently who have the virus. So first to China, Hubei province. So the first figures, the death rate is 10.22% and the recovery rate is 89.78%. The second figures, the death rate is 4.03% and the recovery rate is 35.37%. China excluding Hubei province, the death rate is 1.12% and the recovery rate is 98.88%. Overall, the death rate is 0.81% and the recovery rate is 71.59%. And globally, excluding China, first figures, the death rate is 15.61% and the recovery rate is 84.39%. Second figures, death rate being 1.52% and the recovery rate being 8.22%. Currently, the figures globally will look somewhat different to the Chinese figures, as in many countries outside of China, the virus is in much earlier stages of spreading than within China. We are now sort of 4 or 5 weeks in China, as opposed to many countries outside China, which are in the first few weeks. So I'd like to talk about the fact that a number of countries banned flights early on from China. USA was quite in the forefront of banning all flights from China, or many flights from China, and so was Italy. And I wonder now whether that decision to do that has actually started to backfire. Now, there's a number of reasons why I say that. The first reason is that if you ban direct flights from China to let's say America or Italy, for example, then people who want to go to those countries will just find an alternative route to get there. So I suspect many of those people who were originally wanting to fly direct from, say, China to Italy have now flown from a third country, and as they've entered Italy, they've received no checks whatsoever, because they've been seen that they've come from a country other than China. And the second thing, and a number of experts have pointed out this, if you receive a flight directly from China, at least you are able to keep track of those passengers. So if you get a plane in from China and you know of all the details on those passengers on that plane, you can log where they're staying, where they plan on traveling, how long they will be in your country for. So if then there is an outbreak, it's very much quicker to trace those patients, where if they've come in on a different flight from a third country, then there'll be no tracking put in place. So those people will then be free to mingle within the population without any knowledge of what their condition is, if they are actually carrying the COVID virus or not. And it will then be very difficult to track down other people that they've come into contact with, etc. So in my opinion, and the opinion of many experts, that really is not the smartest move to make. Banning travel from a country is only a good measure if you can be assured that that virus is only in that one country. But if that virus has spread or is spreading to other countries, then really this sort of idea of banning travel from that one country is really not a smart idea at all. So the main thing I'd like to discuss in today's update, and what I hinted at in the title, is, do the USA have a COVID-19 problem? It appears not, as a week or so ago, Donald Trump says it's all okay because the weather will get warmer in April and COVID-19 will go away. And on Wednesday of this week, he says also it's not a problem because we're testing everybody we need to. However, reading a number of articles and a number of reports online, this really does not seem to be the case. Because on the same Wednesday that he said they are testing everybody they need to, the US confirmed its first case of coronavirus with unknown origin, providing the first evidence that the virus is spreading undetected around and inside of the US. And on Monday, it was also reported that clinicians were unable to test a patient in a hospital in the US due to lack of testing kits. This really strikes me as sort of a bit strange, as that all the other countries around the world apart from China have had kind of a month's head start. China have done a lot to contain the virus as much as possibly can. And the World Health Organization have been for a number of weeks warning other countries to get prepared for an outbreak, but it seems the US are not prepared. As of February the 25th, the CD says it had only tested 445 people, and out of that 445 people, it's confirmed 15 cases. And these are not the cases that have been repatriated from other countries. These are cases that have appeared within the US. There's also no central monitoring of people who are being monitored or under self-quarantine. So this is done on a sort of ad hoc basis. Each state, each health authority are doing their own thing. There's no central monitoring or counting of this. So testing, if you compare the population of the USA with sort of around 300 million people or so, they've only tested 445 people. And when you compare this to other countries, for example, the UK has 65 million people. They've already conducted 7,000 plus tests and have an aggressive plan in action to test many, many more. South Korea have already tested 30,000 people, tested many more, and set up drive-through testing within the space of about a week. And the state of Ontario in Canada have already tested 629 people, which is more than the whole of the USA. So it does seem very strange to me that the USA seem to be a little bit behind the curve with this, to be fair. This may be down to the fact that only a dozen or so states and local health authorities have the ability to test for coronavirus in the US. Apparently, out of the 100 or so public health labs, only 3 are able to test. The ones that do test and get positive results, those results then have to be confirmed by the CDC in Atlanta. So not only are they testing very few people, but it's also taking quite a long time to confirm the results of any testing. And currently, CDC guidelines only recommend testing people who are both showing symptoms of a respiratory illness and have either recently been to China or close contact with somebody who currently has been diagnosed with COVID-19. And many experts have called for the CDC to sort of widen, to expand its guidelines on this so they can test more people. So what's gone wrong? Well, the CDC, after approval from the FDA, rapidly developed a testing kit for the US and shipped it out everywhere. But what happened is that this testing kit arrived and then there was seen to be a faulty component in this, so they had to be scrapped. And the CDC apparently has been actively working to produce a new kit to send out to all the authorities. But apparently as yet that new kit has not been finalized, and nobody seems to know exactly when it will be. There also remain questions about the budget and staffing of the CDC. Apparently under the Trump administration, a lot of the funding for the CDC has been cut. There also seems to be some difference in thinking between the White House and the CDC. On Wednesday, Donald Trump directly contradicted the CDC, noting that he didn't think outbreaks were inevitable a day after the CDC suggested they were inevitable. The state of Hawaii are so concerned about the lack of testing available, they have applied to the CDC to allow them to use testing kits imported from Japan. I should, however, stress at this point that experts have pointed that as yet there is not a significant increase in people turning up at hospitals with long-related illnesses. However, I would like to add my opinion here. I think it's kind of bizarre that many people, especially in the US, in our comments section, are criticizing the government in China for their slow action with dealing with this outbreak. Now, I don't personally think that is the case. I personally think they dealt with it as fast as they possibly could once they had the facts at hand. I know a number of people are suggesting that it took them more than a month to start acting. I personally don't believe that. I've looked at a number of timelines that suggest that is not the case, and I will be doing another video in the future that covers this particular aspect of the outbreak. However, that is not for now. Anyway, that brings me to the end of today's update. As always, I really appreciate everybody who supports us and watches this channel. If you'd like to go that extra mile and support us financially, we have WeChat, we have Buy Me a Coffee, and we have Patreon. Put those graphics on the screen right now, and the links are down below if you so wish to contribute to us through that. It's not a problem if you don't want to. As always, if you like this video, please give us the thumbs up. If you like the channel, consider subscribing to us, and if you want to get notified at that moment we release a new video, hit those bells. But as always, for now, take care.